From the Information Services News Desk, this is a special tip of the day publication for Information and Technology Services. It's the Mission Integration and ERD Training for ITS.
Christ's redemption and saving grace embrace the whole person, especially in his or her illness, suffering, and death. The Catholic healthcare ministry faces the reality of death with the confidence of faith. In the face of death for many, a time when hope seems lost, the Church witnesses to her belief that God has created each person for eternal life. Above all, as a witness to its faith, a Catholic healthcare institution will be a community of respect, love, and support to patients, or residents, and their families, as they face the reality of death. What is hardest to face is the process of dying itself, especially the dependency, the helplessness, and the pain that so often accompany terminal illness. One of the primary purposes of medicine in caring for the dying is the relief of pain and the suffering caused by it. Effective management of pain, in all its forms, is critical in the appropriate care of the dying. The truth that life is a precious gift from God has profound implications for the question of stewardship over human life. We are not the owners of our lives, and, hence, do not have absolute power over life. We have a duty to preserve our life, and to use it for the glory of God, but the duty to preserve life is not absolute, for we may reject life-prolonging procedures that are insufficiently beneficial, or excessively burdensome. Suicide and euthanasia are never morally acceptable options. The task of medicine is to care, even when it cannot cure. Physicians and their patients must evaluate the use of the technology at their disposal. Reflection on the innate dignity of human life in all its dimensions, and on the purpose of medical care is indispensable for formulating a true moral judgment about the use of technology to maintain life. The use of life-sustaining technology is judged in light of the Christian meaning of life, suffering, and death. In this way two extremes are avoided: on the one hand, an insistence on useless or burdensome technology, even when a patient may legitimately wish to forego it, and, on the other hand, the withdrawal of technology with the intention of causing death. In summary, this ERD embraces the following. Belief: the process of dying is the most difficult for people to face, and the management of pain is critical to appropriate care of the dying. Belief that medicine is to care even when it cannot cure, and to provide proportionate care, reasonable hope of benefit, to preserve life. Opposes any action, or omission of action that intentionally causes death, in order that suffering may be eliminated. Encourages and provides means for organ and tissue donation. This has been a Tip of the Day publication. For additional Tip of the Day publications, please subscribe to the HSHS Information Services YouTube channel. If you have a comment about the content of this Tip of the Day, or would like to make a suggestion for an upcoming publication, please send an email to tipoftheday@hshs.org.